My name is Tim Southern, Clinical Microbiology Fellow with the University of Nebraska Medical Center and the Nebraska Public Health Laboratory. Today I would like to share with you changes in stool specimen testing in the Clinical Microbiology Laboratory at Nebraska Medicine. Many bacteria, viruses, and parasites can cause infectious diarrhea. Previously, many of these pathogens could only be identified following stool culture or ova and parasite exam. These tests are labor-intensive, time-consuming, and lack sensitivity. Effective January 6, 2015, the Clinical Microbiology Laboratory at Nebraska Medicine will introduce a new FDA-approved molecular test called the Gastrointestinal Pathogen Panel, or GIP, for the rapid detection of bacteria, viruses, and parasites from stool. The GIP is a qualitative nucleic acid amplification test that will detect 22 pathogens that commonly cause infectious diarrhea. The 22 targets include 13 bacteria, 5 viruses, and 4 parasites. The GI panel will be performed daily on all shifts with same-day reporting, which is a significant improvement in turnaround time compared to traditional stool culture. Please keep in mind, reporting may be delayed in the event of heavy testing volume. Bacterial targets on the GI panel include Campylobacter, which will detect Campylobacter jejuni, Campylobacter coli, and Campylobacter absaliensis, Plesiomonas shigelloides, Salmonella, Vibrio, which will detect Vibrio perihemolyticus and Vibrio vulnificus, and Yersinia enterocolitica. There is also a Vibrio cholera specific analyte on the GI panel. Although Clostridium difficile is on the GI panel, it will not be reported. If a stool specimen tests positive for C. difficile using the GI panel, the ordering clinician will be notified by a microbiology fellow, and further C. difficile testing will be discussed. Additional bacterial targets include several diarrheagenic E. coli and Shigella. These targets include enteroaggregative E. coli, enteropathogenic E. coli, enterotoxigenic E. coli, and Shigella toxin-producing E. coli. The panel also includes a specific analyte for the commonly encountered E. coli 0157, as well as an analyte to detect Shigella and enteroinvasive E. coli, or EIEC. Parasite targets include Cryptosporidium, Giardia lamblia, Entamoeba histolytica, and Cyclosporia cayetanensis. Viral targets included on the GI panel are adenovirus F40 and 41, astrovirus, norovirus G1, G2, rotavirus A, and sapovirus. It is important to note that the GI panel does not differentiate norovirus G1 and G2 subtypes, so further molecular testing at the Molecular Diagnostics Laboratory will be needed if discrimination between subtypes is required. GI panel results will be communicated in an easy-to-read report that will list all targets as well as not detected or detected for each target. Additional testing will be performed on all stool specimens positive for Campylobacter and or Shigella EIEC. A recovery culture will be reflexively ordered for these specimens to allow pathogen recovery and antimicrobial susceptibility testing. Recovery cultures and antimicrobial susceptibility are routinely performed for stools positive for Campylobacter and Shigella EIEC. Requests for recovery cultures and antimicrobial susceptibility testing for other organisms on the GI panel should be directed to Paul Fay, Laboratory Director. Healthcare professionals at Nebraska Medicine have prepared a document that provides guidance for result interpretation and treatment of infectious diarrhea based on GI panel results. In this document is a table listing each GI panel target, common disease presentation, common sources and seasonality, treatment recommendations, and antibiotic recommendations when appropriate. This document can be found on the Antimicrobial Stewardship Program webpage on the Nebraska Medicine website. The The document is also available upon request from Regional Pathology Services. Acceptable specimens for GI panel testing include fresh stool, if received within 2 hours of collection, and stool in Carey-Blair or enteric plus transport medium. Fresh stool specimens not received within 2 hours of collection or stool specimens in any other transport medium or fixative will be rejected for GI panel testing. Following implementation of the GI panel, stool cultures, Yersinia cultures, Vibrio cultures, and the Cryptosporidium giardia screen will no longer be offered by the Clinical Microbiology Laboratory at Nebraska Medicine. The GI panel provides coverage for all pathogens detected by these tests. Changes in stool specimen testing will not affect any other stool specimen test offered by the Clinical Microbiology Laboratory at Nebraska Medicine. The laboratory will still provide full ova and parasite examination, rotavirus antigen testing, and testing for Clostridium difficile. The Molecular Diagnostic Laboratory at Nebraska Medicine will also continue to offer testing for adenovirus and norovirus. Please contact Paul Fay, Laboratory Director, or Amy Krisman, Microbiology Manager, with questions regarding implementation of the GI panel. Thank you for your time.